I welcome Coordinator Mr. Agni Prasad Timilsina and HOD Social Science Ms. Binda Thapa. COVID-19 has taken an unprecedented toll on our lives. World is flooded with people pouring out their accounts of loss, depression, confusion, loneliness, inability to cope with circumstances, and most important, what lies ahead. As we all know, sound mental health is very bit as important as physical health for achieving developmental milestones and is of utmost importance for emotional well-being and social skills. The pandemic brought a complex array of challenges which had mental health repercussions like grief, fear, uncertainty, social isolation, even parental fatigue. Now we have Arnav Gimre from Sudesha School, Nepal, to present his views on mental health. Welcome, Arnav.
Thank you, ma'am.
If it's possible for you, you can switch on your camera as well if it is not an issue.
Okay, ma'am.
Arnob, I have presented for you.
Impact of COVID-19 lockdown. Lockdown is considered to be an effective measure in slowing the spread of coronavirus around the globe. To further stop the spread of the virus, many countries are currently in some degree of lockdown. Until then, extreme social distancing is pretty much the only intervention available to keep healthy individuals spacing from each other. Even in the best case scenario, coronavirus vaccine development is likely to take 12 or 18 months, while the preventive vaccines and treatments options are yet to be developed. The worldwide spread of novel coronavirus has further led to functional tissues such as fear, anxiety, depression, panic attack, psychomotor excitement, suicidal death, and a general decrease in overall well-being. Similarly, patients who are infected the infected with COVID-19 are at a greater risk of developing mental health problems as they are facing stigma and discrimination from their own family members. Similar situations were faced by the general public as well as many medical practitioners during previous outbreaks such as acute respiratory syndrome, Middle East respiratory syndrome, and Ebola. Until now, there is a paucity of information on the psychologist aspect of the Nepalese community in the face of COVID-19, which is critical for guiding policies and intervention curb the pandemic. Impact on media sector. The misinformation and inaccurate conception are spreading quicker from fake and unauthorized news portal website, contributing to myth and rumors in the society. Myth related to alcohol adding hot peppers, gingers, and garlic to food, and exposing oneself to temperatures higher than 25 degrees or to cold weathers and snow to kill the coronavirus are misleading people. Therefore, there is a need to be thoughtful and conscious when communicating on social media and other communication platform. Authorized health organization and the government should provide timely information thought through reliable portal platform and ban unauthorized website to avoid misleading the public. A large number of people have assumed the lockdown as vacation time and are pressurizing others to engage in forceful academic or job related activities. Due to the lockdown, several social networking media messages instead of promoting are accurately compromising the mental strategies, and not all can perceive the pandemic lockdown as an opportunity to sorry opportunity to learn. Several messages are demanding people to come out with new skills during the lockdown, which has further aggravated the psychological pressure and mental stress. So on. Impact on health. Although Nepal lacks routine national level data on suicide, media together with police data suggests that about 500 Nepalese committed suicide every year. In addition, a significant rise in the number of people committing suicide was patterned across the world. A notable increase in suicide rate occur after natural disasters such as floods, hurricanes, and pandemic. The pandemic-related restraints such as spatial distancing, isolation, and some home quarantine are impacting on economic sustainability and well-being, which may induce psychological mediators such as sadness, worry, fear, anger, annoyance, frustration, guilt, helplessness, loneliness, and nervousness. In the first month of the nationwide lockdown, a total of 487 people committed suicide, which is 20% more compared with mid-February to mid-March, when the number stood at 410. The data compared by Nepal police shows that from the onset of lockdown, 23 March till 6 June, a total of 1,227 suicide cases were filed, which is seriously high compared with the total of 5,785 people in the previous year. The decrease has had used burning, stabbing, downing, jumping from height as major way of attempting suicide. While the exact case of death remain unknown, counselors have linked it with the mental health of people who have forced to stay indoor during lockdown and so on. According to the Nepal Living Standards Survey 2010 to 2011, 25% of the population lived below the poverty line. The link between poverty and communicable diseases is well evident. COVID-19 is no exception and has triggered increasing unemployment, loan default, and major economic losses around the globe. The economic downturn caused by COVID-19 can increase the economic instability, health inequalities, and social disparities in Nepal, which can have a huge impact on the poverty levels. While the lockdown has affected traders, especially people with small shops and those with limited source of income, the poor, marginalized people, and daily wages are more vulnerable. Research has shown that a pandemic like COVID-19 can result in increased mental burden to marginalized or low-income people. Impact on education. The action of government of Nepal to close all educational institutions, postponing of all national level examination, and prohibiting the gathering of more than 25 people together lead to an outflow of more than 3 lakh people from Kathmandu in 3 days. Parents have experienced increased pressure to work from home to keep their work running, as well as to take care of schooling children at home at the same time, while caregiver resources including grandparents and the wider family have been restricted. Most of the parents have worries about their children education and future as their school education has been halted until further notice. The government of Nepal thought decided to introduce a digital education system to continue the teaching learning process, and this has further burdened parents with the load of school fees and online internet fees. It is further stressful for parents with a low income who have to struggle for daily wages and do not have proper internet access, as it compromises to learning needs of their children. While Nepal can boast inexpensive, accessible, and familiar resources such as radio network, television, broadcasting, and social media for remote learning, it is important to access the sustainability of its own existing resources and checking in the possibilities before deliberately imposing them on on accessible on institution and the public. A large number of people have assumed the lockdown as vacation time and are pressurizing others to engage in forceful academic or job-related activities during the lockdown. Several social networking media messages, instead of promoting, are actually compromising the mental health of individual in the society. People have their individual coping strategies, and not all can perceive the pandemic lockdown as an opportunity to learn. Conclusion: the lockdown curfew, self isolation, social distancing, and quarantine have affected the overall physical, mental, spiritual, and social well-being of the Nepalese. With the beginning of lockdown, the government decided to shut down the all cinema halls, gym, health clubs, and museums, as well as banned the gathering of people for cultural, social, or religious activities, including temple, monasteries, church, and mosque. In the case of death, the pandemic has disrupted.
Thank you, Arnav, for such a deep insight of Nepal's economy and mental health of the people. Now we have from Modern School, Saida and Zhalak presenting bringing their presentation for all of us. Over to you, Zhalak and Saida.
Good morning, everyone. My name is Amna Kazi from Modern School, Nagpur, 12th A. We both are psychology students from Modern School, Nagpur, India, and we are here to discuss and share our thoughts on the topic, the effects of COVID-19 on the outlook of people towards life. The COVID-19 effect. The COVID-19 has affected our mental and physical health. Youth is now forced to stay at home instead of spending time with friends and going to school. Due to this pandemic, we are very cautious about interactions with others. This unfortunate incident had led us to be disconnected from our friends and family and can only connect virtually with them.
So we conducted a survey asking hundreds of people the questions related to their experiences with COVID-19, which they encountered directly or indirectly. Following are the questions we asked them.
The first question that was asked was, how did the pandemic make you feel? As we can see from the pie chart, 36% of the people said that they were annoyed. I feel that this mostly depends upon the nature of the person, as during this pandemic, many people who are introverts were having a better time than the extroverts. The second question that we asked them was, when did you start taking serious precautions? 39% of the people said that as soon as they heard about it. This shows how concerned they were about the pandemic. The third question was, where did you observe changes in your lifestyle after the pandemic situation? 69% of the people said that their habits changed. It is sure a difficult question, as not only has our habit changed, but also our morning routine and the way we handle our expenses has also changed. The next question was, where did, in the year 2020 to 2021, what were you not satisfied with the decision made by the government? As we can see from the pie chart, 66% of the people said that they were unhappy with closing of small businesses. This shows how concerned the people were about the lower sections of the society. The next question was, where did you expect a second wave of COVID-19? 40% of the people said yes. 35.3% of the people was somewhat had a thought of they thought that the COVID-19 would arrive, and 23.9 said no. Next slide, please, Chalak. The last question, what were your feelings during the second wave of COVID-19? 46% of the people said that they panicked during the second wave of COVID as it was causing a considerable degree of fear, worry, anxiety among the population at large. How can you cope with the stress and anxiety you are experiencing because of the pandemic? As you can see from the pie chart, 43% said they coped with stress with new hobbies.
Thank you so much, Saida and Jalak, for your insight on the mental health. Now we have from Sudesha School, Nepal, Kabindra Bhandari, who would be talking about the impact of COVID on the economies.
Warm namaste and good morning to you all the respective teachers and my friends. It's me Kavindra Bhandari of Sudesha School of Nepal, Lalitpur. Today me and my friends are here to share our presentation on the topic impact of COVID-19 in economic sector of Nepal. So without delay any our time, we would like to start our pre- presentation by giving introduction to COVID-19. The outbreak of coronavirus disease COVID-19 has been declared a public health emergency of international concern PHAIC, and the virus has now spread to many countries as territories. While a lot is still unknown about the virus that causes COVID-19, we do know that is transmitted through direct contact with respiratory droplets of an infected person generated through coughing and sneezing. Individuals can be infected from touching surface contaminated with virus and touching their face, example, eyes, nose, mouth. While COVID-19 continues to spread, it is important that communities take action to prevent further transmission, reduce the impact of the outbreak, and support controls measures. Nepal's economy. Nepal's economy economy is largely driven driven by agriculture, which contributed about 26.998 percent to the country's gross domestic product GDP in 2019, or declined from 27.59 percentage in the previous fiscal year. After agriculture, it is remittance which contributes substantially to the country's economic. According to the Nepal's reports by Nepal Rashtra Bank, in fiscal year 2018 to 2019, remittance contributed to nearly 25% of its GDP. Tourism is another significant sector of its economic. All these sectors are now facing an acute crisis due to the COVID-19 pandemic. It is now estimated that Nepal could record a real GDP at basic prices of around 2% or lower. This will sorely affect a country where nearly 18% of its population lives below the poverty line.
Impact in education sector. So far, data suggests that children under the age of 18 years represents about 8.5% of reported cases, with relatively few deaths compared to other age groups and usually mild disease. However, cases of critical illness have been reported. As with adults, pre-existing medical conditions have been suggested as a risk factor for diseases and intensive care admission in children. Further studies are underway to assess the risks of infection in children and to be better understand transmission in this age group.
Community levels measures carry out early detection, testing, contact tracing, and quarantine of contacts. Investigate clusters, ensure physical distancing, hand and hygienic practice, and age-appropriate mask use. Shield vulnerable groups, community-led initiative initiatives such as addressing misleading rumors also play an important role in reducing the risks of infection. Policy, practice, and infrastructure ensure the necessary research policies and infrastructure are in place that protect the health and safety of all school personnel, including people at higher risks. Behavioral experts consider the age and capacity of the student to understand and respect measures put in place. Younger children may find it more difficult to adhere to physical distancing or the appropriate use of masks. Safety and security. Over to Prapti.
Nepal had planned for the Visit Nepal 221, but due to the COVID-19, Visit Nepal 221 was cancelled, and the tourism industry of Nepal had a great loss. Many people who wanted to climb the Mount Everest, but due to the COVID-19, the dream to climb Mount Everest was gone, and many people were sad. Bad impact in agricultural sector. A rapid assessment of socio-economic impact of COVID-19 in Nepal revealed that the virus will seriously derail the achievement of SDGs if external donor supporters are not made available on scale indeed to fight the disease and its impact. Our analysis from the current study reveals that consequences will spill over to multiple SDGs with an immediate threat to two intricately interrelated goals. The goals are no poverty and zero hunger, and negative effects on all pillars of the food security, that is availability, access, utilization, and stability. Of the four pillars, the profound impact in short term is seen in availability and access to food, and in long term it will impact all the four pillars of food security. Similarly, different farming systems are also being affected differently.
Conclusion. The COVID-19 pandemic has greatly affected the Nepal's economy. To address the challenges, the government announced certain measures while several countries and international institutions have provided some assistance. All of these efforts may reduce the impact of the pandemic and improve the country's economic situation. However, the extent of recovery has to be empirically observed. Thank you.
Very deep research. Now we move on. Our own student from modern school, Himang Arya, he will be presenting on the same topic, the impact of COVID on mental health and economics. Over to you, Himang.
Thank you, ma'am. Good morning, everyone. I am Himankarya of class 12C Modern School, India, and today I am going to talk about the impact of COVID. At first, let's take the case study of India and the impact of COVID-19 on the Indian economy. The impact of the coronavirus pandemic on India has been largely disruptive in terms of economic activity as well as a loss of human lives. Almost all the sectors have been adversely affected as the domestic demand and exports sharply plummeted, with some notable exceptions where growth was high. India's growth in the fourth quarter of the fiscal year 2020 went down to 3.1% according to the Ministry of Statistics. The graph here shows the economic growth of various countries. As per a report by CMIE, India lost over 6.3 million jobs during the first wave, followed by while many of the lost jobs were restored prior to the second wave. The impact on the agricultural sector. Since agriculture is the backbone of the country, it is the primary sector which employs a large chunk of the population. India is home to about 120 million smallhold farmers who contribute over 40% of the grain production. With the ongoing pandemic, livelihoods of all the people indulged in this sector is at a higher risk. Indian farmers are already facing issues like low rainfall, price volatility, and rising debts, and now the pandemic has also brought some fresh new challenges for them. The daily wages of the farm laborers have also come down by at least 40%. The contribution of the tourism sector to our GDP stands at 2.5% respectively. The tourism sector served approximately 43 million people in the year 2018-19. The pandemic has caused the significant job losses in the tourism sector after the lockdown was implemented. This sector is staring at a potential 38 million layoffs, which translates to 70% of the workforce. A report from NCAER said 14.5 million jobs were lost during the first quarter, 5.2 million during the second, and another 1.8 million jobs during the third quarter of 2020-21. The tourism sector has been dealing with severe cash flow issues since the start of the pandemic. Now, let's move on to Bangladesh. The impact of COVID-19 on Bangladesh's economy. Like in most other nations, the outbreak of the COVID-19 pandemic was an unprecedented shock to Bangladesh's economy. The GDP growth forecast of Bangladesh by IMF, WB, and ADB has been revised downward from 7.8 to 8.2% to a range of 2.0 to 3.8% for financial year 2020-21. The revenue stream of insurance industry is suffering badly due to the pandemic, with fire and marine insurance likely to take the biggest hit. The textile industry was also derailed from its growth trajectory as exports fell by 54.8%, and the shutting down of factories impacted around 2.28 million workers in this industry. Due to the economic halt in place, millions of people are at a risk of losing their jobs in several economic sectors such as ready-made garments, dairy, poultry, transportation and tourism, etc. Tourism and hospitality sectors in trouble. The tourism sector in Bangladesh is projected to lose BDT 57 billion, putting the jobs of 40 million people at risk. Travel restrictions and flight cancellations have led to a significant decrease in the occupancy rates of hotels, which is also shown in Figure 1. Figure 2 shows the change in number of weekly flights due to the COVID restrictions. Last but not least, now it is the case study of Uganda. The Ugandan economy is still emerging from the devastating impact of COVID-19, but prospects for growth are undermined by increasing pressure on its natural resources. Impact of COVID-19 on Uganda's economy. The country's GDP contracted by 1.1% in 2020 and is estimated to have recovered to 3.3% during the 2021 fiscal year. 7,80,000 people will become poor in the short term, while 2.6 million in the long run. Exports are expected to decline due to sharp reduction in global demand and travel restrictions. The significant shift of the Ugandans towards agriculture has heightened the urgency for the country to enhance the sustainable use of natural resources. Immediate losses in the tourism industry. Tourism contributes to approximately 10% of the GDP and over US dollars 1.6 billion in foreign exchange. The stoppage of airline travels and imposition of quarantines on inbound travelers across the globe led to a complete fall in the number of tourist arrivals in Uganda. Now, I would like to conclude my presentation. It was lovely sharing this information with you all. Have a nice day. Thank you.
Thank you, Himang. Now we move to Nidhi Bhoyer. She will be presenting her presentation. Over to you, Nidhi.
Yes, ma'am. Good morning to all present here. I am Nidhi Bhoyer, studying in class 12 from Model School, Nagpur, India, is going to present and share my knowledge about the impact of COVID-19 pandemic on the economy of South Asian countries, which will include India, Nepal, Bangladesh, and Uganda. COVID-19's outbreak had a widespread impact on the health conditions along with the economic conditions of the countries. The South Asian countries were among the immensely clashed countries. Over 50 million people lost their life. The death toll reached 1.2 million by the end of November 2020 and then continued to rise. It resulted sharp changes on major economic indicators and sectors. Bangladesh had 40% decline in its economy and 0.89 million jobs at risk. Speaking about Nepal, almost every sector was slashed, showing up to 0.13% of GDP. Now we shall proceed towards the impact of COVID-19 on major economic indicators. Existence of COVID in the economy failed the upcoming government and organizational plans and also the present market, which henceforth affected the growth of major indicators of economy, which are GDP, remittance inflows, and inflation rate. As we can see in the graph, Bangladesh growth rate fell from 8.2% in 2019 to 7.8% in 2020, and it advanced to 8% in 2021, which is still less than 2019, and this advancement was because of global improvement in consumers' confidence towards market. Nepal's growth rate fell from 7.1% in 2019 to 5.3% in 2020. This huge was because of clash down in the most major sectors, which was tourism and agriculture, but it rose to 6.4% in 2021. India being the largest among them had huge impact compared to others. On an average, South Asian countries had a substantial increase in their annual inflation from 3.3% in 2019 and real GDP at 6.6% in 2020. Further talking about the impact on the remittance inflows and inflation rate, the shutdowns have likely impacted private consumption, main engine of growth. While remittances were robust in the first half of the year, they were likely to decline, reducing household consumption. Inflation in Bangladesh slowed following good crop harvest, and current account deficit narrowed as the trade deficit shrank and remittance expanded further. Consumer price inflation in India spiked about 2% to 6% in December 2019 and moved up from 4.6% in 2019 to 6% in Nepal. The dramatic spread of COVID-19 has affected trade, economy, and businesses heading toward the severe recession. The business had shut down, hampering trading, and henceforth lesser industrial production, shortage of workers, etc., affecting the economy. Few industries affected are manufacturing industry. This industry plays a vital role in the economic growth of developing countries. Countries with fewer manufacturing opportunities were less affected than those with high level of manufacturing of light and heavy products like India. From the table, we can say that the percent of total GDP and sector GDP decline in negative. In COVID-19, pharmaceutical resources associated in this region ramped up to South Asian countries which showed strong GDP growth, and however in 2019 it ended up being lower than expected. India being largest provider of generic drugs globally, Indian pharmaceutical sector supplies over 50% of global demand for various vaccines, and it grew to $100 billion. Bangladesh local pharmaceutical industries emerged as game changer, contributing 90% of overall medicine and currently exporting to 145 countries. In Nepal, the role of pharmaceutical industry is invaluable for economic revolution of country. Pharmaceutical market there is less regulated. Some of the most affected sectors in South Asia due to COVID are tourism, hotel and restaurant, which created around 50 million jobs in 2018, employed about 43 million people, which has been severely affected in COVID. The growth rate of this sector has decreased to 11.6% in Bangladesh, 6.7% in India, and 3.6% in Nepal. COVID-19 led to prolonged school closures to varying degrees. These affect the skills students acquire and eventually their productivity as future workforce. Learning losses range to 55%. The present value of these losses is estimated at $1.25 trillion. Now, talking about the booming sectors of the economy, the world witnessed one of its worst pandemics ever. The economy saw a gradual downfall in first wave, but still the COVID and the lockdown has affected some sectors positively. Among them are e-retail sector. In the pandemic situation, people have come across online shopping platforms for groceries, which is no less than a boon for a e-retail sector because people couldn't move out of their house as per lockdown restrictions. The number of online shoppers in South Asia is growing annually by 5% and 9%. Healthcare sector. COVID-19 brought healthcare as a priority for everyone. The pandemic proved to be so disruptive that products like masks, sanitizer, and personal hygiene equipment immensely increased. Healthcare market is expected to reach $193.83 billion by 2020 and $372 billion by 2022, driven by rising income, better health awareness, lifestyle diseases, and increasing access to insurance. Digital sector. During pandemic, people have begun to use digital media to work commitment, schooling, and entertainment. The use of online forums for business meeting has exploded in popularity. Online channels for digital content have become a big success with many movies released digitally, etc. because of limitations on gathering and crowd. Banking on and finance sector. Unemployment and health problems has exacerbated the financial problem of the society. Regulated financial service providers and non-banking financial companies (NBFCs) play a critical role in such situations. In any situation, banks are not going to be immensely affected because people are going to invest, put their savings, etc., which will benefit them. These are some categories in which people were interested to invest during the pandemic, which are stock, real estate, gold, mutual funds, etc. Now, speaking about the impact on Uganda's economy, Uganda had a major impact too. Firms have experienced a significant drop in demand, revenue, and profits and encountered difficulties in accessing customers, inputs, and suppliers. Employment and earnings also dropped significantly during lockdown, but not as much as firm revenues. As we can see from the graph, the fund requirement by public has increased in 2020 to 2,400 billion, and the share of budget has increased from 2.7% to 3.7%. Also, the ability of repaying outstanding loans is severely reduced, majority in small and medium scale industries, whereas the large one has no impact. At the end of my presentation, I would like to say that every other problem has some way from it. In terms of government support, firms and employees highlighted interest rate subsidies, cash transfers, and social assistance grants as key policies to support recovery. India announced an economic stimulus package, 1.7 trillion rupees for low-income families. So step by step there will be an acceptance of new normal and the economic markets will improve. Learning from past experience from 1.5 years. Thank you so much. Stay safe and stay healthy.
Now we have Harshita Bongiri. Harshita, over to you.
Thank you, ma'am. Good morning, everyone. A hearty welcome to all the teachers, dignitaries, and my dear friends to today's event. My name is Harshita Bongiri from Class 12A, Modern School, India. Today I am here to talk about the effect of COVID-19 on the economy of the country. The COVID-19 pandemic, known as the novel coronavirus, had hit the economy of the world with a remarkable speed and a restless manner, leading to a dramatic loss of human life worldwide and presented an unprecedented challenge to public health, food system, and the world of work. The economy and the social disruption caused by the pandemic was devastating. According to the studies, nearly 10 millions of people were at the risk of falling into extreme poverty, while the undernourished one currently estimated to be nearly 690 million and can increase by 132 more by the end of the year. The COVID-19 patch in the world seemed that the initial gap between public health, according to the WHO, when the news of COVID-19 came, people start taking precaution, but because of some negligent one, the COVID-19 pandemic keep increasing and affected the various sectors of the economy. The impact of COVID-19 on the education sector. As COVID-19 pandemic continued to spread worldwide, while government worldwide continued to shut down schools and colleges in attempt to contain the spread of virus. As per the UCNO reports, over 1.5 million of schools and colleges were stuck at home in the midst of ongoing pandemic, representing close of 190% of the global student population. seeming that 1.38 billion students were at the home. But with the help of technological updates, people were able to continue. Students were able to continue with the studies. The change in education policies had played a vital role. With the advancement and the support of government as well as the education system, people were able to cope up in the hard time. But some unfortunate one who were not able to access to online education left behind, because of which the gap between the poor and the richer widened again. Impact of COVID-19 on the agricultural sector. Agricultural sector, being the backbone of the economy, has a major role to play on the economy of the country. But with the hit of COVID-19, the agriculture sector had also been hit in a restless manner. The total GDP rate contributed by agriculture sector seemed to have a downfall. Minimum 40% of Indian population had used to earn their living from agriculture sector. But because of shutdown and unavailability of resources, many people had no income, and the agriculture sector had also a great hit. The following figures show how the India, Nepal, Sri Lanka, Pakistan, Maldives, Nepal, and Afghanistan's economy, that is the overall South Asian economy, was affected due to the COVID-19 effect. Travel sector. Travel sector, being the most growing one in the past economy, had been hit severely because of the pandemic. According to the studies till date, the losses were more than 4 trillion to the global GDP. And the reports jointly represented with the UN World Tourism says that international tourism and its closely likely sector suffered a loss of 2.4 trillion in 2020 due to the direct and indirect impact on steam. Drop in the international tourism arrival, up to 2.4 trillion losses accepted in 2021. Moving towards the job provided by the tourism sector, the tourism sector, being the rising one, had the capability of providing 35% of job every year in the economy, but because of the shut and travel restriction, 5.5 because of the shut of tourism sector, the reduction in tourism case caused a 5.5 rise in the unemployment and unskilled labor on an average basis. On July, that is last year, the UNCTAD estimated that 4 to 12 months timeline in the international tourism would cost global economy between 1 to 2 trillion and 3.3 million, including indirect costs. Moving towards the service sector. The service sector, being the highest job provider in the economy, had also suffered a lot. Accepted losses will be higher in Indian economy for shorter and longer containment, provided that up to $1,969.05 to $4,273.83 million losses have been found. The process was also affected other South Asian country trading agriculture, as India is the leading in the region of the production and exporting product and raw material. Moving towards the manufacturing sector. The lockdown affected the industrial and the management sector in an immense way. Due to the shutdown, lot of unskilled labor and the labor working on a daily basis have lost their jobs. Sole proprietors, small businesses have to close down. Even the growing businesses had to suffer immense losses. According to the studies, nearly 3.3 million global force was at the risk of losing their livelihoods, and moreover, half of them lost too. And for most, no income means no food or less less nutritious food, leading to an immense increase in the malnutrition cases worldwide. This is the graph. Increase in unemployment level was found due to the COVID effect on the economy. Pharmaceutical sector. Apart from all the sector, a pharmaceutical sector was the one which showed a boom in the COVID-19 because of the urgent need of the pharmaceutical requirement. The pharmaceuticals show a higher of 14.6% than 2019. The two pharmaceutical stock generally unformed at the market in the past 2 years, but by 16 March 2021, stocks in the company as tracked by the global data were 25.8% and above. The pharmaceutical sector had showed a boom in all the economy, including India, showing a boom by 30%, Bangladesh by 40%, and Nepal by only 10% because of less production of pharmaceutical sector. These are the graphs showing how the downfall and the upstream had been caused in the pharmaceutical sector during the COVID pandemic. Moving towards the banking sector. Banking and all businesses are hunkering down to safety and soundly keeping operating in light to the COVID-19 pandemic. At the same time, many banks were working to stabilize their own operation with more liquid workforce and reboot digital channel to address the demand. Banking providing finance, and finance being the blood of every business, was the one which was least affected because of the help of e-commerce. With the help of e-commerce, the banking sector were able to regulate money supply in the economy and help the industry and all the sectors in order to gain finance to grow in the pandemic situation. These are the graphs showing how the different banking sector cope up in the COVID-19 pandemic after the hit. The overall COVID impact on external private finance in the developing economy is estimated to be USD 700 billion and could exceed the impact of the finance crisis by 60% as compared to the study of 2008. Impact on GDP growth rate. The GDP growth rate of the South Asian country after COVID-19 break both nominal and real GDP were taken into consideration. According to the studies, the growth in South Asian country is forecasted to decelerate from 5.1 in 2019 to 4.1 in 2020 and rebounded to 6.0 in 2021 with the help of e-commerce. First, the growth rate percentage in South Asian country from 2015 to 2021 was used to examine the unadjusted market. The graphical representations show how Bangladesh, India, and Nepal and Uganda cope up from the falling GDP to a rising one. But the increasing and the decreasing rate continues because of the uncertainty heading in the economy. The following graphs show how the real GDP had been affected, and the estimate study shows that how it would be further till 2004. Impact on remittance and e-flow and inflation rate. Impact of COVID-19 on remittance and e-flow and inflation rate. The national shutdown is likely to impact private consumption. Remittance can increase growth, but the effect is only significant at low levels of economy and the development. For developing country, remittance and foreign direct investment both seem to have positive and statistical significant consequence on per the capital income. Remittance inflow in South Asian country has significantly decreased because of the COVID-19 outbreak, and the inflation rate period projected scenario presented in the figure show how the inflation rate and the remittance inflow have been increasing and decreasing during the COVID-19 period. Heading towards the effect of COVID-19 on the Uganda economy, the country declared the state of emergency, issued stay at home and order. The survey asked by the household whether income had decreased since the outbreak in the midst of March. According to the study, we estimate that 256 million individuals, that is 77% of the individual across the four countries, live in the household that have lost income since the onset of pandemic. A pandemic had also caused a great impact to various sectors of the economy of Uganda. The following graphs show how the sectors have been affected and how, with the help of e-commerce, sectors were able to cope up. The access to basic necessities and education had been seen to be less in Uganda, but with the cope up of the government policies, are now able to indulge more with the studies and online media through online medium. Coming to an end, we all know that COVID-19 has affected our life in an immense and dramatic way, but we can't and we didn't stop. Life is a path paved with stone, and they create barrier, and we are the one who have to cross them and head towards success. I would request all of you to follow all the norms, rules and regulation, mask on, follow social distancing. क्योंकि कहते हैं ना, 2 गज दूरी, मास्क और सैनिटाइजर है जरूरी. Wish you all a very good day. Stay home, stay safe, and stay healthy. Thank you.
Saida and Jala, you can even unmute and speak. Saida and Jala, over to you.
Yes, ma'am. Thank you so much. We are really sorry for the earlier inconvenience, but honestly, it has been a great experience to perform this survey. And as psychology students, we ensured that all the ethical issues like informed consent of the subject, voluntary participation of the subject, and confidentiality of the data source are strictly followed. Over to you, Amina.
Thank you, Jalak. This survey has helped us know how various kind of people felt during this pandemic and what did they do to protect themselves and their loved ones and what kind of experience they went through. We have prepared some questions and we would love to know your thoughts on it. So I'll proceed with my question. The first question is, how will you protect yourself and your loved ones from COVID-19?
Your participation would be appreciated. Please, you can all unmute yourselves and answer, or you can also type in the chat box.
I will repeat my question, that how will you protect yourself and your loved ones from COVID-19?
Okay, so I would like to, yeah, please continue, please.
thank you, Jalak, for asking these questions. I will give the advice to the people who are not wearing masks, them to wear masks and giving them sanitizer if they don't have, and keeping 2 meter distance when we are gathering. And this kind of advice I will give.
Yeah.
Thank you so much. I would totally agree with that. Uh, doing having social distancing and wearing mask is very necessary to protect themselves as well as our people around you. Anyone?
Thank you, Medha, for answering, and Suraj and Khushbu. Thank you so much. We agree with you all.
Do you think it is important to protect both mental as well as physical health during this pandemic?
Uh,
The impact of COVID-19 pandemic is drastically changing people, including the lives of young people. Schools and universities have closed, exams and events postponed. The usual health information services are limited. Socializing with friends and wider family is highly discouraged and in some places even punishable. Living in these circumstances can be tough for young people for their social, physical, and mental well being. That's why it is really important to maintain physical health. It will prevent us from getting infected, and mental health. It will give us hope or courage and will keep us active.
Thank you so much, Khushbu. Thank you, Kiran. Thank you, Pranisha. Thank you, Kajal ma'am and Suraj, Ishwari. Thank you so much.
We'll proceed with the third question. How do you offer emotional support to friends or family members who have been quarantined?
People show emotional support for others by offering genuine encouragement, recurrence, and compassion. This might include things like verbal expression of sympathy or physical gestures of affection. Emotional support can come from other sources too, religious or spiritual sources, community activities, or every your pets, whatever whatever form it takes. This support can improve anyone's outlook and general wellness during quarantines, as we can physically be in touch with the friends or distant family members. We can encourage them. Everything is going to be okay by talking to them frequently. Watch some entertaining movies in video call. Thank you.
Yeah, we totally agree with you. And Kiran, Khushbu, Suraj, and Lisa, we all agree with you also. Your views are very great on this. Thank you so much.
We'll hop on to the next question. If COVID 19 is to stay for the next 2 years, what is your preference of mode of learning in future? Is it offline or online?
Suraj says I prefer blended mode. Yeah, correct. We agree.
We agree with this quite well because blended learning, because offline, online has both its advantages and disadvantages.
Thank you, Kiran and Khushbu, for your answers. We appreciate you all.
And we are done with the questions.
Thank you so much for cooperating with all of us, and a special thanks to Samuel sir who provided all the help and support we needed. Thank you so much, sir. And at the end, I would like to say, stay safe, stay healthy, and stay smart. Thank you so much.
Stay safe, everyone. Thank you.
Thank you, ma'am.
Thank you, everyone, for joining today's program. I would like to extend my thank to Principal Ms. Birangana Mahajan of Sudesha School, Nepal. Birangana ma'am, if you would like to speak few words.
Thank you, ma'am. Thank you for this opportunity for our school to give this platform to share the information about deep information and digital information about this COVID-19. Thank you very much. We hope that similar sessions will be going on in coming days. Thank you very much, ma'am.
Thank you very much once again to everyone.